imagine this. You're on a luxury cruise ship, sailing through these ecologically breathtaking, super remote islands in the South Atlantic. I mean, it's literally the trip of a lifetime, right? But then, an invisible threat boards the ship. We're going to bypass the usual pleasantries today because we need to plunge right into a high-stakes, unfolding medical mystery. One that recently caught the full attention of the World Health Organization. Welcome to The Explainer. I'm your host, and today, we are putting on our detective hats to track down a truly terrifying pathogen. Let's get into it.
The escalation here is just devastatingly rapid. On April 6, 2026, a passenger on a Dutch-flagged cruise ship develops a fever, a headache, maybe some mild diarrhea. Seems pretty normal, right? But just 5 days later, on April 11th, he goes into severe respiratory distress and, tragically, he dies. Then, 2 weeks later, a close contact goes ashore on St. Helena with GI symptoms. Her condition absolutely plummets on a medical flight to South Africa, and she dies right as they arrive on April 26th. By May 4th, out of just 147 people on board, we are looking at 7 total cases and 3 deaths.
So, the crucial point is, this is definitely not your average travel bug. The culprit we're hunting down today carries a staggering fatality rate of up to 50% in the Americas. I mean, literally a coin flip. This is a life-or-death situation playing out in real time out on the open ocean. You've got passengers locked down in their cabins and international medical teams just completely scrambling for answers.
And that brings us to the biggest question of all. What exactly is happening to the passengers of this ship? I mean, what kind of microscopic invader causes mild stomach issues one day and then sudden fatal respiratory collapse just a few days later? To figure that out, we have to pull back from the sheer drama of this cruise ship and launch a rigorous scientific investigation.
Section 1. Meet the Hantavirus. Identifying the suspect. So, on May 2nd, the National Institute for Communicable Diseases down in South Africa finally cornered our suspect. They ran some PCR tests, polymerase chain reaction, on a critically ill passenger who had been medically evacuated. And boom, they confirmed an infection with an ortho-hantavirus. We finally had our culprit. But hantaviruses are a really complex family. So which specific profile are we dealing with here?
Well, the hantavirus essentially has 2 main phases. On one hand, we've got hemorrhagic fever with renal syndrome, or HFRS. That one mostly strikes in Europe and Asia, goes right after the kidneys, and has a fatality rate of about 1 to 15%. Bad, for sure, but on the other hand, we have hantavirus cardiopulmonary syndrome, or HCPS. This is the strain found in the Americas. It violently attacks the lungs and, carries that terrifying 50% fatality rate. Given the massive respiratory distress and pneumonia we saw on the cruise ship, all signs point directly to HCPS.
But how in the world did it get onto a luxury cruise ship in the first place? Well, hantaviruses are zoonotic. Their primary hosts are wild sylvatic rodents, think field mice and rats. And the wild part is, you don't even have to get bitten to get infected. Humans catch it primarily by inhaling aerosolized excreta, basically breathing in microscopic airborne particles of dried rodent urine or feces. Now, this ship had departed from Ushuaia, Argentina, and made a bunch of ecotourism stops in these highly diverse, super remote habitats. Those excursions likely put passengers right in the middle of wild rodent territory. Oh, and while person-to-person spread is incredibly rare, it actually has been documented in close contact settings with a specific South American variant called the Andes virus. So you can see how a cruise ship is kind of a powder keg for this.
Section 2. The vascular leakage problem, a plumbing disaster. Okay, let's dive into this. Because to truly understand why this pathogen is so incredibly lethal, we have to look under the hood. We need to become microscopic detectives and look at the biological mechanisms going haywire inside the patients. We are essentially looking at a catastrophic biological plumbing disaster.
See, the virus isn't actually targeting the lung tissue itself. Nope. It targets the endothelial cells. Think of your circulatory system like a massive, complex network of pipes. The endothelial cells are the crucial inner lining of those pipes. They act as this really strict security barrier, keeping your blood and fluids inside the vessels where they belong, while only letting very specific nutrients pass through.
Now, what's really interesting about this vascular leakage hypothesis is how the virus breaks those vital pipes down. Picture a normal, healthy blood vessel wall holding strong. Now imagine a high load of hantavirus RNA crashing into it. The virus infects those endothelial cells and basically alters their key structural proteins. Specifically, it drops the levels of VE caterina, alters a protein called ZO1, and hyperphosphorylates a receptor called VFGR2. I know, that's a lot of science jargon, but in simple terms, it chemically forces the cells lining your blood vessels to just pull apart,
It literally punches microscopic holes in your internal plumbing, which leads to massive, rapid fluid leakage straight into the lungs.
Section 3. Your own worst enemy, the double-edged sword. Now, here is the most fascinating and, honestly, the most tragic scientific twist in our entire investigation. The hantavirus is actually considered non-cytopathogenic. That's just a fancy medical way of saying the virus itself doesn't actually kill human cells on its own. So, if the virus isn't destroying the blood vessels, what is? Well, the call is coming from inside the house.
It's the body's own immune system rushing to the scene. The second the innate immune system detects the virus, it starts blasting out chemical distress signals. Your body's most powerful defenders, things like CD8 positive, cytotoxic T cells, and monocytes, swarm the infected endothelial cells, trying to clear the virus out. But here's the catch. Their response is so unbelievably aggressive that their weapons inadvertently destroy the exact blood vessels they are trying to protect. It drastically worsens the vascular leakage.
As the clinical literature so perfectly puts it, inflammatory cytokines and chemokines produced by the antiviral innate response is like a double-edged sword. This is exactly what we call a cytokine storm. And to make matters even worse, patients also suffer from acute thrombocytopenia, which is a severe, sudden drop in platelets. So think about it. Just as your immune system is blowing holes in your blood vessels, your body is simultaneously being stripped of the exact platelets it needs to patch those leaks up. It is literally a perfect, deadly storm.
Section 4. Prevention and treatment. Plugging the leaks. So, when you're dealing with a virus that turns the human body against itself and literally drowns the lungs in plasma, how do you even fight it? Let's pivot to some practical, forward-looking measures. We need to look at how medical professionals actually treat the sick, and just as importantly, how they protect the healthy people still stuck on that ship. The frightening truth here is that, as of right now, there are absolutely no specific antiviral treatments or vaccines approved for hantavirus cardiopulmonary syndrome. Antiviral drugs like ribavirin, they just haven't proven effective against this specific pulmonary strain. Because of that, doctors have to rely almost entirely on incredibly aggressive supportive therapies. It becomes a total race against time. We're talking immediate transfer to an intensive care unit. Doctors have to meticulously manage fluid levels to somehow counteract the leaky vessels. They use mechanical ventilation to literally breathe for the patient. And in the most critical, extreme cases, they have to hook them up to ECMO, extracorporeal mechanical oxygenation, which oxygenates the blood entirely outside of the body just to give the lungs a chance to recover. But while the doctors are desperately fighting for the sick, public health officials have to step in and stop the spread. The World Health Organization laid out some surprisingly simple but utterly vital guidelines to halt the outbreak on this ship. Step 1, maximize physical distancing and isolate anyone sick. Step 2 and 3 are absolutely critical. Strictly use wet cleaning methods with heavy disinfectants, and absolutely never, under any circumstances, use dry sweeping. Remember how the virus spreads? Through aerosolized rodent droppings. Dry sweeping would just launch that lethal virus straight back into the air for everyone to breathe. And finally, step 4, institute rigorous rodent control to cut off the source entirely.
The outbreak on this particular cruise ship was a truly terrifying reminder of our own vulnerability. But, it also points to a much, much larger issue. As global travel and ecotourism push us further and further into untouched wild habitats, into the deep forests and remote islands where these wild rodents have lived undisturbed for centuries, what hidden risks are we awakening? Are we casually crossing invisible boundaries that we are totally unprepared for? It's a pretty heavy question, and it's one that researchers, and really all of us as global travelers, are going to have to grapple with in the years to come. Thanks for joining me on this explainer, and as always, keep your curiosity sharp.